Classics 107.9, time for our daily check-in with our dear friend, Dr. Monique Gary. Good afternoon, Doc.
Hey, good afternoon. How we doing today?
To be honest, I'm a little bit perturbed today as I watch the nightly news and see this man in the White House and he and his staff being tested every day, anytime they want, now wearing their mask in the West Wing. And when the reporter asked him yesterday, doesn't he think that all Americans should be able to get tested the way he and his staff are getting tested, his answer was just appalling. And that is my concern right now, the testing, the tracing. Let's talk about it.
All right, let's talk about the 3 T's because we are getting closer, and we know that it takes 3 T's in order for us to reopen. Tracing or tracking, we need testing, and we need treatment. So yesterday we talked about tracing and tracking, and people really need to wrap their heads around this. You need to get used to the idea that there are going to be apps that will help people to follow where you've been and who you've been in contact with, and there are going to be trained individuals who will go through neighborhoods and talk to people who have been diagnosed with coronavirus, and they have to do this in order to figure out where they've been, who they've been in contact with, so that we can do the appropriate quarantine and so that we can get back outside. This is something that people need to get used to the idea of. There will be tracing, there will be tracking. It is not a violation of your rights in order to do that. It is to protect the greater good of society.
That was my question. Do you think people will be open to this whole tracking thing to see who they were in contact with? Do you think people will be open to that?
No, but that's why we're talking about it, because I need them to get used to it, and also because maybe you can be one of the tracers and the trackers so you can make sure that the right thing is being done in your community. Definitely go on the websites and look and become an employee. If you need a job, this is a great job for you if it's available. But if we're tracking ourselves, then we don't have to worry about who's tracking us and what they're doing with that information. We'll know.
Oh, I get it. You're right.
Right. On the testing side of things, there had been only one kind of test to detect an active infection, and now there's a second type of test called an antigen test, which looks for the protein traces of the virus, like a rapid test, like flu or strep throat. So this is a test that we're doing in my hospital to clear people for surgery. So 2 days before their surgery, my patients have to get a rapid test, and that way they can know if they have COVID, and if they do, then they're not necessarily going ahead with their elective surgery. But this testing is becoming more widespread, and so if you are symptomatic, you need to go somewhere and get this testing done. If you are asymptomatic and you want to test, I think we're still waiting on the rest of the world to catch up to the White House crew so that we too can get tested. But you need to definitely talk to your provider if you have any symptoms at all, or if you've been in contact with anyone who has the coronavirus. Even if they are asymptomatic, you still should be tested.
Right. Because the thing is, I think that's the scariest part, is that someone can be asymptomatic, they don't know that they have corona, and now they're in contact with you, and then you get very sick and you get all the symptoms.
It's true, and this is why I've been avoiding, even my family members. I want to go around and visit my family, but I could be the person carrying it, and I have people in my family who are immunocompromised, and have autoimmune diseases. So I have to be really careful and make sure I wear a mask. And that's what it is. It's social responsibility. It's not an infringement on anybody's rights to ask them to wear a mask. It is social responsibility and care for, humankind. Like we're supposed to look out for each other. Okay. So the third thing is treatment. There are some combination antiviral drugs that are starting to work. The FDA is approving them, and they are in phase 2 trials that are underway, meaning they're working out the doses and making sure the drugs are strong enough, making sure the response lasts. So we're finally starting to see some really good treatments for people who are symptomatic, and the death rates and mortality rates are going down. So, treatment is coming up as well, and we have to make sure that the government does the right thing and gives the treatments to those who need it. But there is treatment available and on the horizon, so everybody can really take heart. We're going to get through this.
I pray that we do, because I just don't feel like those folks in the White House are considering the impact that it's having on the African-American community. So fingers are crossed. I'm praying and hoping that those treatments trickle down to our neighborhoods. Absolutely. All right, I have a question about measles in our kids, but I'll save that for tomorrow.
Okay, we'll talk about measles and vaccines tomorrow, because we still need to get vaccines. This is a scary time as we think about, getting medications and some clinical trials and who's experimenting on people, but we have to do what we know works so that we don't have this issue every year, right? This would be horrible for something like this to come up again next year. So we got to do the right thing and just take good care of each other. We get through this.
Yes, we will, together, from your mouth to God's ears. Doc, thanks for calling in again today. We so appreciate your knowledge and you taking the time to share that knowledge with us.
It is my privilege. As always, you can follow me on social media, Dr. Monique Gary, on LinkedIn, Facebook, Twitter, and Instagram. I look forward to seeing and hearing from everybody. Take good care.
Peace and love.